We've seen a huge advantage to smaller homes versus large homes in the reopening situation that's going on right now. Obviously, larger homes who have, 200, 300, 400 beds are going to have more employees. So there's obviously that opportunity with the larger employee base for people out there to contract COVID who haven't been vaccinated and so forth. And as soon as that happens, there's dictates by the state and federal government that you have to shut visiting down. And that can vary depending on how quickly you can get all the patients tested and how quickly you can get all the employees tested. But certainly where you have a smaller facility, first of all, right out of the gate, there's a smaller chance that you're going to have an employee, who gets COVID. The second thing is, if you have an employee that gets COVID, you're going to have a lot easier time getting all the residents tested because there's less residents, and getting all the employees tested because there's less employees. Basically what you have to do is go through, test all the rest of the residents, test all the rest of the employees, and make sure nobody has COVID, and it's just that one isolated case. What's happening in these larger homes is by the time they get done testing all the residents and all the employees, boom, another employee pops up and has COVID. So you're in this almost chasing your tail, never-ending cycle of being able to get back to visiting. It's very difficult for these homes. I feel sorry for them, but it is one advantage that a smaller home has over a larger home. I think you have to take a lot of things into account. In a larger facility, there's different things that they do there that's different from a smaller facility. You have to evaluate those things. Certainly visiting is top of mind. When people come in, they want to know, will I be able to visit my family member? If something happens where COVID happens to pop up in the community or in the facility, what's going to happen with visiting? How are you going to look at that? What is the state and federal government telling you as far as visiting goes? So visiting is definitely top of the list, but there's other things too that from a clinical standpoint, what the facility is able to provide, and just the feeling you get when you walk in the facility. How does it feel to you? Are people greeting you? Do you feel welcome? What do the other residents in the facility look like when you tour? All those things still play into the picture, but certainly visiting has become the new, kind of buzz statement that comes in when somebody comes in the door. First thing they ask is, are you open? Can we visit? So visiting is the new 5 senses, right?